Hello friends, now we will discuss about the coronavirus. This is a single strand, non-segmented positive sense enveloped virus. This has glycoprotein on its surface which looks like crown, so it is named as coronavirus. This is the third epidemic of this virus which has spread to cause pandemic. First epidemic was reported in China in 2003, second epidemic in Saudi Arabia in 2012. Coronaviruses are large family of viruses that cause illness ranging from common cold to more severe diseases such as middle east respiratory syndrome, severe acute respiratory syndrome. Coronaviruses are zoonotic, meaning that they transmitted between animals and people. SARS-CoV-2 is the seventh coronavirus known to infect humans. SARS-CoV, MERS-CoV, and SARS-CoV-2 can cause severe disease, whereas HKU1, NL63, OC43, 229F are associated with mild symptoms. Now we will discuss about the pathogenesis of this virus. That is, the virus enters by inhalation of droplets of the respiratory secretions by infected patients. It reaches lung and binds to ACE2 receptor and begin its infectivity there. The spike protein of SARS-CoV-2 has a functional polybasic cleavage site which also adds to its infectivity. Now we will discuss about the transmission of this virus. Mainly it is by inhalation of the droplets, contact with body fluids, local contact like handshake, hugging. The source is banded krait, Chinese cobra. Earlier it spread from animal to human, now it is spreading from human to human. The common symptoms are fever, dry cough and fatigue. Few uncommon symptoms like headache, nasal congestion, sore throat, coughing up sputum, shortness of breath, pain in muscles or joints, chills, nausea, vomiting, and diarrhea can occur. In severe disease, the patient can have high fever, coughing up blood, decreased white blood cells, and kidney failure. Now, how do we diagnose the coronavirus infection and how do we confirm the diagnosis? We take specimens like nasopharyngeal or oropharyngeal swab, sputum if available, endotracheal aspirate or bronchoalveolar lavage if the patient is ventilated. The best to confirm the diagnosis is by real-time PCR. If it is positive, then we have to repeat the test every 3 days till it becomes negative. If negative, then we repeat the test after 24 hours. The treatment is mainly supportive, and there is no standard or specific treatment which is recommended by WHO. There is no vaccine which is available. If the patient is having shortness of breath, then we give oxygen by mask, IV fluid if needed. If the patient is having upper respiratory tract infection and the PCR is positive, then we give treatment which is based on prior coronavirus epidemic with chloroquine and oseltamivir, the 5-day regime. If the patient is also having pneumonia, then we add darunavir cobicistat, which is a protease inhibitor, and we prescribe it for 2 weeks. The best is to prevent the infection, which is done by frequently wash your hands with an alcohol-based hand rub or soap. Cover your mouth and nose when sneezing or coughing. Avoid close contact with anyone who has a fever or cough. Seek early medical help if you have a fever, cough, and difficulty breathing. Avoid direct, unprotected contact with live animals. Avoid eating raw or undercooked animal products. There are few myths which are associated with this virus. The first is about antibiotic. Antibiotics are not effective against this virus because they are only to cure or treat bacterial diseases. And this coronavirus can affect any age group. This is not specifically that this is affecting more older population, but the case fatality rate is high in older population because they are immunocompromised. Also, the case fatality high in people having heart disease or who are having diabetes mellitus and who are in a range of 30 to 60 years. Thank you.